Ladies and gentlemen, welcome back to my YouTube video channel. Just kidding around, guys. Hello everyone, welcome back to my YouTube video channel. This is Dr. Lockwin. I'm going to continue sharing you case after case, how we go about to use the technology to improve your practice. Here's a case for study model of the orthodontist case. Take a look at the case, guys. With the Manic 500 machine, I'm just keeping spreading the news about a 3D scanner, guys. 3D scanner is amazing. Help you to scan the case and and then you send it out digitally, and the lab will print it out, and then you can easily evaluate the problem with the patient, whether it's cosmetic dentistry or an implant dentistry or an orthodontist case. In this particular video, I'm showing you the orthodontist case. Okay, so patient chip complaint where she doesn't like the lower teeth at all, but that's understandable. You know, her upper teeth look quite straight, but after I printed out, I just show her that, you know, there's more than just a problem with the lower teeth. The upper teeth have also a problem. The major problem with the upper teeth is that number 16 have really super erupted and touch almost the gum of number 17 area. That's something that I told her that we will have to discuss how we're going to move it either forward. We might have to put anchorage implant to pull it upward and then forward, or we just have to pull the tube depending on what her choice. If she doesn't like implant, then that's what we have to do.